And I noticed that there was a lump, completely unexpected, and it was invasive ductal carcinoma. My life was flipped upside down all the same week that the COVID pandemic was announced.
Hello people, welcome back to Chatterdocs. I'm Dr. Tor and I'm an internal medicine physician. Today I have a good friend of mine, Dr. Kavita Jackson, who is a great emergency medicine physician in Maryland. She's here with us to share some awesome points about breast cancer. Hi Kavita, how are you?
Hi Sam, I'm doing well. How are you today?
Good. Thanks for asking. So me and Kavita, our history goes back to our residency time when I was an internal medicine resident and she was in emergency medicine, and I had a rotation with her. We talked over the phone all the time, and I really enjoyed my experience and my friendship with you. I think you were one of the best emergency medicine doctors back in the hospital.
That's a huge compliment, and I really value our friendship, relationship, colleagueship, whatever it is. The learning went both ways. I think I learned more from you than you realize and more than you did from me, but I'm really happy to be here today.
Thank you so much. All right, so I'm not gonna say anything. You just tell us your story.
So I had just moved to the DMV area and was starting as a brand new attending, getting my kids settled into school, trying to get doctors for them and for my husband. It was the holiday time last year. I felt a pain in my right breast and I kind of just grabbed it like this, and then I noticed that there was a lump, a mass. I didn't have a doctor at that time because I was so focused on family and starting my new job, so I quickly got a primary care doctor who astutely recommended a ultrasound, and she also recommended a mammogram. And at that time I thought it was a little overkill, but I said, you're the doctor, you're the expert, I will follow your recommendations. I had the mammogram and ultrasound done, and then I was recommended a biopsy. We did the biopsy, and I received my path results actually while I was at work. I got the phone call and I waited till I got home to look at the results, just in case it wasn't a fibroadenoma cyst, and it was invasive ductal carcinoma. Completely unexpected. My life was flipped upside down, and this was all the same week that the COVID pandemic was announced in our country. A lot of unexpected, scary things, a lot of unknown. That's where I was. I was pushed into the unknown. I had to leave work immediately to start chemotherapy, which I did for 4 months, and then I had surgery. Luckily, my pathology report showed no traces of cancer left. And then I pursued the double mastectomy to reduce my risk of recurrence coming back, because I am young and I have a long life ahead to live. The chances of it coming back were just not something that I wanted to live with. So that's where I am now. I have healed and recovered from my double mastectomy, and here we are.
Wow, I'm really glad that you're well, and there's just so much to learn from your own personal story. And as we say, let's debunk some myths about breast cancer, some misconceptions, because this is a very common disease. This is a very preventable disease and a very treatable disease that people really need to learn about. So the first myth, Kavita, how old are you? Like, everyone think that breast cancer or any cancer is for older people, but you're pretty young.
I was 32 when I was diagnosed, and I'm 33 now. It is true that the majority happens in middle-aged to older women, with age and being female being risk factors for breast cancer. But in 2017, about 4% of breast cancer was diagnosed in women under the age of 40. And I myself debunked that myth, having been diagnosed at the age of 32. So no, breast cancer does not only happen to older women.
Okay, did you have any family members with breast cancer disease?
No, so nobody in my family, extending all the way back to all my relatives in India, has had breast cancer or any cancer of any kind. I am the first one. So about 5 to 10% of breast cancer is hereditary, meaning that it can pass down through families, and we do know of the BRCA1 and BRCA2 gene that have been identified. If you have those genes, your risk of breast cancer is high, and we know that. However, for the majority, there may not be a family history or a clear lineage of a history of breast cancer. You might be the first one to be diagnosed.
All right, so next myth. If I have a very healthy lifestyle, I exercise, I don't take alcohol, my diet is good, and my weight is good, things like that, I will not get breast cancer.
So these are great things to practice, and although they can lower your risk of breast cancer, just because you do all of these things, they cannot eliminate or prevent breast cancer. So I will say I followed all of these things. Like, yes, my weight could have been a little bit better. I definitely could have exercised a little bit more, and I still got breast cancer. So no, it's not your fault. There is risk in everything we do in our lives, and don't beat yourself up about it. If breast cancer is going to happen, it's going to happen.
Okay, so tell us, what should we do anyways? Like, is there anything that we can do to prevent it or something?
So I'm a big advocate of the self-breast exam. It's something, I'll be honest, I didn't do before I was diagnosed with breast cancer because of the recommendations we learn in medical school from the governing bodies that make the expert guidelines. And I understood the research behind why they were not promoting it very heavily. But now, obviously, my opinion differs a little bit, and I wonder if I had been doing my self-breast exams, if I would have detected the cancer sooner. I won't know the answer to that, but now I do choose to do the self-breast exam. It's something easily once a month that essentially you want to understand what's normal for your body so that you can identify when anything changes. But there's a whole segment on how to do a self-breast exam on my Instagram stories at Dr. Kavita Jackson. So it's very simple to do a self-breast exam. You want to do it once a month, so either on the first of the month, just remember, feel it on the first, or a couple days after your period ends. Whatever you do, just pick the same date every month. You're going to first look, and then you're going to feel. So look in the mirror with your hands up here on your head, hands on your waist. Look at how your breasts are, and then you're going to feel. Take 2 fingers to the opposite breast. You're gonna make small circular motions from the nipple all the way out. You can also do it up and down or side to side, and then check the other breast. It's not important so much which method you pick as it is to do it regularly, do the same method, do it consistently. So if there's anything abnormal or anything changes, you can bring it up to your doctor. Abnormal things would be if you're feeling pain that you didn't have before, if you feel a new mass, if you have discharge from your nipple, especially blood, or anything like that, bring it up to your doctor for further investigation.
Sounds good. Is there any recommendation for getting it checked out by the partner or something? Just wondering.
I don't think so. Some people, and all of this is not published guidelines. Even ACOG and stuff right now, they are promoting awareness, but no one, like American Cancer Society says, like, don't do it. Don't do self-breast exams.
And the reason behind that is because it will end up in finding false positives and stuff like that, I believe.
High false positives, yeah. And we don't have any clear data.
Correct.
I think the research hasn't really been done that it helps. And if it doesn't help, then they don't recommend it.
I see. And it's not a rocket thing, it's just a cheap thing that you can do at home, and again, sometimes your partner can enjoy from doing it anyways, every month or a week or something.
Do it however it's fun for you, or however make sure that it gets done. Actually, I've heard of people whose partners have picked up on abnormalities or lumps, and they were diagnosed with breast cancer. I think it's something like up to 40% of women actually discover their own mass or the change that happened that they subsequently ended up being diagnosed with breast cancer. So you have a lot of power by understanding your body and what's normal, so you can notice when things change.
So the next myth, wearing a bra or using a deodorant or putting a cell phone in the bra can increase the risk of cancer.
This is a great myth to debunk. We have multiple research studies that have showed us there is no link between doing any of these things and getting breast cancer.
Sounds good. I don't even know why someone would put a cell phone in the bra. Do people do that?
Well, people do that. I've noticed it in Philly, actually. Okay. Like some of the women, they just like tuck it in there. I don't know.
I guess because we have a lot of pockets. I don't understand what women go through because of not having any pockets.
I would always carry my phones here, but then it would weigh down my pocket.
And it will fall down if you bend forward.
Exactly.
Okay, makes sense. Yeah. So don't worry. put anything you want in there. That's fine. All right, the next myth. Mammograms guarantee that the breast cancer will be found early.
So unfortunately, in medicine, nothing is guaranteed. Mammograms are absolutely key. They are the only effective screening method for detecting breast cancer, but they're not perfect. Especially in women that are younger, that have more dense breasts, it can miss some smaller tumors. So physicians or radiologists may adjunct the mammogram with a MRI.
Sounds good. What is, just as a bonus point, what is the recommended schedule right now for screening mammograms?
So the recommended screening in the average risk female is about to start at age 40 or age 50, depending on which expert recommendations you look at.
I see. And it's every year or every 2 years, again, depending on the guideline.
Can be every year, correct, or every 2 years. And for women that are at increased risk, they need to be screened earlier. And I can't tell you exactly when that is, but it's important to just, bring that up, discuss with your doctor so you guys are looking out for any red flag symptoms and getting the mammograms early.
So you felt a lump in your breast that caused the diagnosis of the breast cancer. Do breast cancers always have lumps that we can feel?
No, unfortunately, or fortunately maybe, they do not. It's possible to have cancer that has even spread outside of your breast without ever feeling a lump. Depending on the stage of the cancer and the location, you may not feel a lump. Or you may see some other abnormal things like bloody discharge from the nipple or a rash. So a lump is not the only sign of breast cancer.
Having it does not mean absolutely you are having breast cancer, and not having it is not ruling it out as well.
Correct. So many actually, and I think this is touch on another myth we're going to talk about, that all lumps are breast cancer. And just like you said, they are not. When we feel a lump, our first concern as a woman is, I have breast cancer. Breast cancer is actually a minority of what those lumps are. More common things are cysts or fibroadenomas, and those are benign tumors. I have heard often that if you have breast pain or a painful lump in your breast, that it cannot be cancer. I myself have debunked that myth, as I found my cancer because of pain. Anything that's abnormal, bring it up to your doctor, get it evaluated.
So this is a very common myth, and even I myself, when I was in medical school, I was shocked to discover that. But only women get breast cancer?
No, so actually quite the contrary. Men are diagnosed with breast cancer as well. About 2,190 men are diagnosed with breast cancer each year, and of this, about 410 of them will pass away due to the disease. So being a man does not preclude you from having breast cancer.
It's sad, you don't get the breast, you don't get any of that, but you get the cancer,
Correct.
That's fucked up.
Actually, just a plug for men. So whether you do the self-breast exam or not, if you find something abnormal, please do not be ashamed. Do not be embarrassed to bring it up to your doctor. You want it evaluated to know that it's not breast cancer.
Even if it's a third nipple, like Chandler had in Friends.
Hey, you never know. You never know.
So are all breast cancers treated the same way?
Absolutely not. There are so many different types of breast cancer depending on the type that you have, how it may or may not respond to hormones, what your BRCA1, BRCA2, or your genetics results are, whether it has spread or not. There's a lot of different things that go into the decision of how to treat breast cancer. And this is important to know because women, all the time I hear, well, my friend had this and that treatment and I'm only getting this and that treatment. Yeah. It can include a combination of any of these things. You can have chemotherapy, plus or minus surgery, plus or minus radiation, plus or minus some long-term medications like tamoxifen. So breast cancer is very diverse and the treatments are as well.
There's a great deal of progress being made on a daily basis or a monthly basis in terms of the tests and treatments that are coming out. Actually, one of our close relatives had breast cancer, and we did this Oncotype DX test on them, which is a genetic test that looks at so many different genes, 21 of them, and then it tells you what's the risk of recurrence. So do you have to get chemotherapy or not, which was new to me as well. I was just looking that up, and fortunately her score was low, so she didn't have to get chemotherapy. So yeah, there's a great deal of science behind it, and it's good and fortunate that there's a lot of treatment ways for breast cancer, and it's now a very treatable disease. Yeah.
And you're right, there's a lot of research in this area, so clinical trials are also an option for a select group of breast cancer patients.
So this brings us to our next myth, specifically for other people dealing with their loved ones having breast cancer. So when you're finished with the therapy of the breast cancer, is it finished, like you're past everything?
Although I don't have it anymore and I am in remission, it has impacted my life for the long term. And like I said, I'm learning what this means. So some people have long-term symptoms like nausea, vomiting, fatigue, or those long-term effects from chemotherapy. Many people have side effects from surgery, such as myself. I have a lot of numbness in my chest and certain areas that I have to remember to even just look in the mirror to see what's going on, because I cannot feel if something was happening there. It has a lot of emotional impact. There's a lot of emotional recovery that I'm doing right now, just thinking about what all has happened and processing those thoughts and going forward, and how I'm going to live my life as a survivor. So no, I guess for better or for worse, it doesn't end when you are in remission. There's a whole life of survivorhood, or for patients who have metastatic breast cancer that has spread outside of the breast. They can live many years, and that's a very different life that they may have imagined before they were diagnosed. So this is a lifelong situation.
Thank you so much. Also, I wanted to mention your blog and your Instagram accounts. Why don't you tell us more about that?
Absolutely. So I started my blog, Dr. Lady, that's drladyblog.com, actually once I was diagnosed, just to write my thoughts out, and it ended up being very therapeutic, and it also helped keep my family up to date, and it just turned into a personal venture and passion of mine, which has also overflowed onto my Instagram, which is Dr. Kavita Jackson, where I just share my raw experiences with breast cancer and how it was to be on the other side of medicine as a patient for the first time.
Sounds great. So I'm sure our audience would also love your posts, and I recommend them to follow you on Instagram and your blog as well. And thank you once again for being here with us. I always enjoy talking to you, and it's always a great pleasure. Thank you for sharing your story with us. And I know it's hard reciting all the pain and the bad experience, but for the sake of bringing awareness, I think it's a very good deed, and in the realm of education and in the realm of medicine and humanity, you know, it's a great deed.
Thank you so much for having me here to be able to share this and debunk some very important myths that people out there are believing. And if it helps one person, it is completely worth it for me. So come find me on Instagram and let's connect.
Sounds great. And once again, if you don't have us subscribed, what's wrong with you? Seriously, please subscribe and share this video, and have a good one. Thanks.